Hi there, my name is Nancy Kabiru. I'm here to talk about mental health on our usual conversation on Hisia Chats. What have you normalized in your life as a man? I would want to know, because we all make our experiences in life, even those that are hard, normal. I'd want you to note if you have gone through stigma or bullying, whether in school, college, university, or even at your workplaces, because sometimes you can be in a toxic work environment. If you are going through relationship challenges, this could be with your spouse, a partner that you intended to have a long-term relationship, or even with your siblings or parents. If you have had challenges with finances, maybe you have lost your job, or you're not earning as much as your expenses are. And if you're having health issues, and health issues could be a diagnosis with a terminal illness or a condition that is hard to treat in this current situation and you are not ready for that. If you're experiencing loss of a loved one, especially during this time where terminal illnesses or pre-existing conditions coupled with COVID crisis is costing us our loved ones. So if you're experiencing grief and loss, or you have been imprisoned at one time in your life, okay, all those are signs or are factors that can push you towards going towards depression or becoming suicidal. And suicide, when we look at the statistics, it is very high in men than it is in women, because men choose lethal means because of the pain that they have had to allow sit in within themselves. So take care to notice what your experiences have been and seek support for those, or so that you can be able to resolve the unfinished businesses. Through the societal eyes, what is expected of men, or how have you been conditioned to relate and deal with mental health issues? We find that a lot of men do not seek support because they are afraid of the stigma or being labeled. So you downplay the feelings and the emotions you're going through. A lot of men classify being depressed and call it being stressed. Okay, so you don't give it the weight it deserves so that you can go seek mental health support. So this downplaying causes you to take in so much until you get to a breaking point. Because of the stigma, a lot of men self-treat their depressive symptoms or mental health challenges by getting into alcohol or substance abuse. So you find a lot of male having addictive tendencies or behaviors to support where they feel they are lacking or where the challenge is. So what can you do to support the men in your lives? Identify if they have gone through the symptoms I've talked about earlier in this video. Second thing, encourage them to seek mental health support from a professional, because a professional will help to declutter their mind. The professional will assess the situation. They will be able to come up with a diagnosis, a treatment plan, and even equip the man with coping skills or tools to help them make their lives easier, more bearable, and even better, so that they are at a position where they appreciate their well-being. The third thing, you can be that listening ear to them. Offer them a space where they feel safe enough to be themselves. Normalize having conversations. Normalize having deep conversation. Encourage the men in your lives to also attend group therapies, where there are groups that can offer them support and the psychological support. And even if they have other challenges in areas of life, say finances, looking for a job, or even identifying what their role is, help them walk that journey. Be patient enough and help them feel adequate, or even help them make the right connections or application for jobs.